daily limb compressions reduce dementia. Short daily bouts of reduced blood flow to an arm or leg can reduce the burden of dementia. It's called remote ischemic conditioning. It activates natural protective mechanisms in the brain which helps vascular dementia patients. Vascular dementia is considered the second most common cause of dementia after Alzheimer's disease, according to the Alzheimer's Association. There are currently no drugs approved by the U.S. Food and Drug Administration for vascular dementia. An age of 65 and above, and being a female, are two of the major risk factors for vascular dementia. This is a big future epidemic. Vascular dementia is a big killer and a disabler, and everybody is concerned about this. Reduced cerebral blood flow, particularly in the deep white matter, is a major trigger of dementia. The deep white matter of brain is primarily composed of axons, which connect neurons and different areas of the brain to each other and enable the brain to communicate with the body. The white protective coating on the axons makes the deep brain area to be called white matter. The white matter is particularly vulnerable to ischemia because the blood vessels supplying are small, and have a long, tortuous routes. Stroke or small vessel disease of the brain can lead to classic dementia symptoms such as forgetfulness and an unsteady gait. By the age of 70, essentially everyone has some white matter disease, but in some it can be devastating. Dr. David Hess, a stroke specialist and the chairman of the Department of Neurology at the Medical College of Georgia at Georgia Regents University, has come with a remedy. The approach uses a blood pressure cuff-like device to temporarily restrict blood flow to a limb repeatedly for a few minutes each day. This increases blood flow to other body areas, including the brain. Increased blood flow activates endothelial cell linings of blood vessels, activating a series of natural protective mechanisms that can be effective wherever blood travels. Interestingly, the mechanisms seem most active in areas of impaired flow, such as those deep inside the brain, where most dementia has its roots. The most powerful way to protect the brain is to cut off blood flow to it for a short period of time to condition it. It opens up many protective pathways so that when a potentially lethal ischemia comes, you can survive it. It permanently improves the blood flow to these deep regions of the brain. In long term, we have to find people who are at risk for dementia. They already may have some white matter damage, as seen on MRI. Then we condition them chronically with this device at their home. This passive therapy provides blood vessels the same benefits of exercise. Studies show that vascular dementia improves with just 2 weeks of daily, short bouts of ischemia to an appendage. It can improve the ischemia of the deep white matter. More amyloid, a protein deposited in the brains of patients with Alzheimer's, is made when the brain blood flow is impaired. The temporary bouts of increased blood flow prompt endothelial cells to make nitric oxide, the precursor for blood vessel dilator. Successive, vigorous bouts of leg compressions following a stroke trigger natural protective mechanisms that reduce damage and double the effectiveness of the clot buster with tissue plasminogen activator. Thank you.